Good afternoon. My name is Sandy Conaway. Welcome to the presentation on the evidence-based innovation project called Cesarean Section OR Setup for Labor and Delivery RNs who circulate on obstetrical cases. In the current environment of this facility, the labor and delivery nurses don't receive the same training as the nurses who circulate in the main OR. According to the Association of Women's Health Obstetric and Neonatal Nurses, or AWON, the OB surgical patient should receive the same level of care as any other patient in any other OR. L&D nurses and a surgical tech will take care of those patients who are having a C-section in labor and delivery. So most of the time what's happening is that labor and delivery nurse is caring for her patient in the labor room, and the scrub tech will gather the supplies, open the supplies, and get the room ready. Then the nurse will come back from labor and delivery, do the surgical count, do the timeouts, and act as a circulating nurse. So they're not used to gathering the supplies or knowing where to gather them. There can be an emergency case, and that surgical tech can be tied up, and now we need that circulating nurse to go gather the supplies and open them. And in the current world, that would take them longer than any other nurse that would circulate in the main OR. A main OR nurse would know exactly what supplies were needed for that case and where to gather them. So looking at this difference in the levels of the RNs, one in the main OR and one in the OB OR, I thought maybe this could be a good innovation project. So I met with the nurse manager and the assistant nurse managers in the L&D unit. I met with a couple of staff members. They would just happen to be sitting at the desk, and there was 3 topics that came up amongst the 3 different groups of people that I talked with. One was vaginal preps for surgical site infection prevention. One was enhanced recovery after surgery, or ERAS for the patients. And the third one was setting up a C-section, gathering the supplies. So I created a survey through SurveyMonkey, sent it out via email with a link for the nurses to answer the survey. When I got my surveys back, over 64%, it was right at 65%, felt like the gathering these supplies and knowing where to get them and how to open them was the most needed. Over half of those people that answered felt like that they did not know even what supplies or where to gather them. So I started my research, and looking at the literature, ARN and AWON again say that that patient needs to be able to experience the same level of care in that OB-OR as if she were in a main OR. So we did have a education need. So starting with that, I used the cognitive theory. Cognitive theory says that we're going to give nurses or the learners some knowledge to go along with their current knowledge to increase it. So these nurses are circulating already, so they have some knowledge, but this information would add to their knowledge. As adult learners, people want to know what they're learning is needed and the whys behind it. And so this education project would meet both of those requirements. So I worked along with a scrub tech as a collaborative partner. They're seeing what's needed for me to get information from them. So I decided to create a small didactic portion of the class to go over the recommendations from ARN and from AWON, what is needed to be a good circulator, what supplies do they need, the purpose of the sterility checks, and to review those with them. I would give a pre-test to see where they're at knowledge-wise, do the presentation, then we would go to the OR. This would be taught in a classroom right outside the OR, so this would give me time to show a demonstration, to use a PowerPoint, and then once I went into the OR, I could do a demonstration of what supplies are needed, how to lay them out, and how to open them. After we did the class, we would have a post-test, and I could see how much knowledge did they gain from the classroom material. The return demonstration would allow me to assess if they could put their knowledge into practice. And then there would be an evaluation of the class to help me to better the class for next time. And what areas was I successful? What areas did I need to improve on? Now, all of this knowledge is good if you're going to use it immediately. But let's say it's an L&D nurse who doesn't do a section for the next 2 weeks, and now she's forgot. So I decided that I would create a list of supplies that was needed, include a picture of each supply, where it would be located. And where would you go if it was not in that initial location? There's usually a storage room. So created that list form with the pictures, And then what the Scrub Tech helped me do is we created a QR code or a quick reference code that they could access with their phone. It's about a 4-minute total video of that Scrub Tech gathering the supplies, laying them out in the field, laying them out in the room, open them in a sterile fashion so that there would be a sterile field created. And this would allow the nurses to go back and review that at any time that they had some downtime. Or if they don't have time to do that, they can at least take those lists out and look at them to see what supplies they're needed. And that when you looked at the list as well, it told you where to place them on the table. So hopefully the classroom will give them the education that they need. I feel like this may be the tip of the iceberg of us giving them more education to get them more, so they can feel more comfortable being a circulator and to have that baseline knowledge that they are not getting in their training. So hopefully this is going to be the tip of the iceberg in order for them to grow as a circulating nurse, and I can see us building on that. I can't wait to see what the statistics show pre and post test and to see if the nurses feel value in this class. Thank you for listening to this.